Good morning. Thank you for asking me to come along today to represent my colleagues in public health and NHS in general. And the first thing I want to say is really well done for the first year of the action reporting, because I think it's been a real step change. Now, I have to work out how to move this on. Right. Okay, so poverty. We know it's out there, and people fall into poverty in many different ways. We know that poverty affects a huge chunk of our population across Scotland, whether it's urban, rural, and we can't forget the rural, because very often rural, it's hidden there. We know that poverty is disproportionately impacts on our children and young people, and we know that actually being in a job and losing a job, addictions, whether it's addictions to alcohol, substance misuse, gambling, can tumble families in and out of poverty. So poverty is not static, it moves and changes across time. Oops. Okay. We've already heard how poverty impacts on young people. Now, whether that's from educational attainment, so getting to school, having the correct books, the information, having that criteria to study. Fuel poverty means that a lot of children are in cold, damp housing. So all of this impacts on our educational outcomes. And that educational attainment is so important for improving our life chances. The time when we have children impacts on our chances of falling into poverty. So teenage pregnancies, early pregnancies when our young people have not established much more chance of becoming, falling into that vulnerable group. Our outcomes, life outcomes, our healthy life outcomes, all are impacted and all are adversely impacted on those poorer groups within our society. So I know our colleagues have talked about who is affected, and I think what is really striking about this is that jobs does no longer completely support and stop families from falling into poverty. The types of jobs, whether those are secure jobs, they're reaching minimum wage jobs, they're not jobs which are working on 0 hours contracts, all of that impacts on our children's outcomes. Again, if we do what we've been doing along the board, this is what is potentially could happen. But as the previous speakers have spoken about, although we've put in a lot of policies and actions to support families, actually how do we get as a community, as us out here within local authority, within NHS, within our wider partners, how do we get those messages to people? Because if we don't do that on the ground, our vulnerable groups are not necessarily going to know what's going to be there to support them. And as I think another colleague suggested, we know the EU exit is happening or not happening, but either way, it has an impact on our economy, and that tumbles down, and the worst effect will always be felt on our poorest in society. So I was thinking about this just over the last week or two, and I've contacted my colleagues across Scotland, so a lot of you are here in the room, so thank you, to get their ideas and their comments and thoughts on how the last year with the Child Poverty Act and reports have actually gone. And I was thinking that this is a real paradigm shift, so this is something very different, in that it's not different that we work across the whole systems, but actually the Child Poverty Action Reporting gives us a real opportunity to formalise that and to really work and show and be very explicit about what we are doing together across the systems. So that paradigm shift that's needed to make those changes, actually this is a real catalyst for that. So we do live and work in really complex systems, and those complex systems are absolutely driven by humans. And as humans, we're slightly unpredictable. We don't come to work every day a clean slate. We bring things with us. We bring things from years ago, from yesterday, from this morning. So whole systems working is difficult. It's not tricky. It's tricky. Not difficult, it's tricky. And I was speaking to a colleague earlier last week, and we were talking about the mental models and challenges that we have. So in our day-to-day lives, we have that top of the iceberg, top of the pyramid. So those events. So events like the Child Poverty Action Reporting. Those things that are clear, they're here, they're there, they're now. They're things we have to do either today, tomorrow, or probably preferably yesterday. Those are the areas that we're focusing on. But to make this sustainable and to make this last, we do have to start to look at that huge chunk of iceberg that sits underneath the water that we don't necessarily see. So those patterns of behaviour, structures of systems, and those, specifically those mental models, those previous thoughts and beliefs that we all bring to work in one way, shape or form. So to achieve that top end, that whole systems working, we do have to work through all of this whole iceberg. And for those of you sitting in this audience who work in that iceberg all the time, that's not easy. That is a tricky place to be. To make this work, we have to be there. So I guess I just wanted to talk about this to say congratulations, because actually you have made things work and you have cut through that iceberg. So it's not to be too hard on yourselves. You're doing a good job. This is not simple. Whole system working is absolutely necessary. We have to work across. As Aileen said, there's no silver bullet for this. This is cross-agency working. And we know the headlines. Sorry, apologies, that keeps popping up. We know the headlines. But actually, as I said previously, Child Poverty Act is a real catalyst for us to start to work more closely together. Because we have worked in the past. It's not new. Now, I contacted colleagues, and I just wanted to start and not go into all of the reporting. Obviously, that's going to be done elsewhere. But just to ask colleagues what they thought were the sort of key issues. So the first one was the whole systems working. And actually, it's really heartening to see that colleagues from across Scotland are working with the community planning partnerships. They're working on combining policies and priorities. It's reducing duplication. It's making our partnerships stronger. We're working through our integrated joint boards, police, fire, third sector, working with those people with lived experience, and really starting to shape and shift and move. And I'm saying this, but this is all of you. This is what those of you who got back, this is what you're doing out there. So that leadership and influence that you can bring, please don't ever underestimate that, because that is where the magic will happen. So working together. So again, I wanted to start to drill down and try and find out what went well, what maybe was slightly trickier. But actually, overwhelmingly, things went well, because I do believe that across the system, we do work well together. And we do work in partnership. As I said before, that whole system's working is not simple. So I guess it's how we can support that system to work, and that leadership's important there. So partnerships with housing, with transport, looking to mitigate those impacts of poverty, working with our colleagues who have developed the Child Poverty Action reporting systems, our programmes of work. So CPPs are wholeheartedly embracing this and working across the NHS and other partners. It's enabling that action that maybe was slightly someone else's problem or someone else's responsibility. It's enabling that to come together, and actually having that dual responsibility is important. So if we're talking about young people who have got parents who are in hospital with long-term conditions, young people who have got parents who have got addiction problems, all of those issues don't just sit within the NHS. We've got to support those families to ensure those young people aren't necessarily becoming unpaid carers. So we're looking at their outcomes and ensuring that they can continue to be at school and be supported, support their transport, etc. So it's about bringing together those outcomes for adults as well as children. And I guess one of the things that really struck me looking at the comments from colleagues was that although we've focused a lot on early years and children, actually we haven't focused so much on our adult services, so adult social work services, adult mental health services, medical, surgical, all of these areas that we know that actually we could make a big difference because these adults quite clearly are the economic drivers for the children. So I think there's things that we can do better and things that we're doing very well at the minute. One of the areas that came up was using a quality improvement approach, and that is important to have that rigour and support and that leadership really to make sure that things happen in a sustainable way. Governance and making sure that our reporting systems falling together, that's always going to be a bit of a juggle on the first year. You know, when are these reported through the NHS board, when are they reported through the CPP board? All of these things are important, but not insurmountable. So the step change, I think the huge step change really, I think, is the financial inclusion pathways. Everyone was talking about how they're working on developing those, and that's so important. So all of the work that Aileen has just talked about, actually informing families, crucially informing our colleagues out there. So not all colleagues are completely aware of their role and their strength in impacting on child poverty, not maybe seeing it in the round. So it's really important that we continue to support our colleagues as well as those who are more probably embedded within child poverty. Child poverty is everyone's business. And if we're looking to reframe child poverty in that way, then this is important. So those step changes of what we're doing out there, and there's a host of things, and I'm not going to go through all of these, but all of the referral teams, so within maternity, those automatic electronic referrals, looking at the cost of pregnancy, the cost of the school day. I mean, it just goes on, inviting in Citizens Advice and other agencies to support families, having them there within GP surgeries, within schools, within our hospitals, really important. Ensuring that we actually do talk to people about fuel poverty. Again, that's maybe not necessarily an NHS responsibility, but it is, because at the end of the day, we've got young people coming in with exacerbations of their asthma, their parents are having exacerbations of their own long-term conditions, so everything is linked. So none of this can stand on its own, absolutely none of it. NHS employability, looking at living wage, all of these things are happening within the NHS, but also happening within our local authorities. And not just making sure that we're working to the living wage, it's making sure that our contractors are also working to the living wage too, which is sometimes not always happening. So consultation, so who were you all talking to? You were talking to people with life experience, what it's like from day to day. What are the problems? I was talking to someone yesterday who brought up something that actually I wasn't aware of. So women who are formula feeding are exchanging their formula on Facebook. So either buying, sharing, so someone's managed to buy 2 tubs of formula and puts on Facebook that they've got one, does someone need it? So there's that social work happening underneath it I wasn't aware of. I'm not sure if you were aware of, but that's just a tiny, tiny wee crumb. Now, obviously, we would like to support these women to be breastfeeding, but we need to be there to support them because they're going to need more support than most. But all of that impact, so talking to women and vulnerable families, talking to, I think, specifically care experience young people These young people have got some of the worst starts in life, yet we do have to give them more support as they're leaving care, going into adulthood and that transition. And that's still a huge piece of work that's happening. And the care review supports that and will make that happen too. But have no doubt, we will have to make that happen in our local areas too. So, just to round up, we do have to absolutely work together. We have to go and attack this like a bear. We have to make sure that we take all of our enthusiasm that I know is in this room, although you're all very, very quiet, take that enthusiasm out there and share it, because we do have to reframe this. You know, it's not the first time I've heard someone say to me, but these families can afford to go to the pub, they can afford Sky TV, they can afford this, that and the other. Actually, we need to step back from that. We need to be looking at the child on their own. That child's got no control over their parents' spending. So we need to develop our own empathy and love and social justice for those children, because these children living in poverty, every hour, day, week, month and year is a long time. So we need to be working on this quickly and picking out those key areas that are working, key areas that need tweaked. And I think you have all done a fantastic job in this first year, and let's just carry on passing on that baton. I'm certainly not going to do this in my working lifetime. I'm hoping I will see this in my living lifetime. But in this room, it's passing that baton on, and it's getting our foot soldiers, ensuring that we build that capacity out there within our communities and within our work colleagues to make this happen more quickly. Okay, thank you very much.